Hi, I'm Dr. Miner. Today I'm here with a client that we are going to do a comprehensive facial treatment. And what we are going to do is botox, filler, dermal threads, and some kybella. Alright, so we're going to do some botox, and the areas that we're going to address are the forehead and around the eyes. And I've had a number of clients that come in and are surprised when I tell them the other places we can put botox, because they tell me, oh, I heard you can't do botox below the eyes. Well, that's simply not true. Botox can be used all over the face. And so today we're going to do some botox for the nose, which is often referred to as bunny lines on the nose. We can also do it under the eye to help with some of the lines that form under the eye. And with this client, we're also going to address down here with some botox to help smooth and soften this area. So there's lots of places in the face that botox can be used, and below the eyes. So let's talk about kybella. And what we're going to do with this client is we're going to use kybella for the jowl area. And she is a little asymmetric in this area, and the jowl over here is a little larger than this side, and so we're going to address this area. And the way kybella works is it breaks down the fat cells and reduces the volume of tissue. And so by using kybella over here, we can make those jowls smaller and help refine that jawline. Now with the threads and filler, we're going to do those together. And there is a sequence with that, in that we do the threads first and the filler second. And the threads are a way to get a non-surgical facelift. So what we're going to do with the threads is lift the area. We're going to lift the cheeks and jowls here. And then we're going to refine the area with some filler. And when we use threads, we end up using about half as much filler, sometimes even less, amount of filler when we use the threads. And we get a real natural, nice looking result. Now we did filler in her lips a while ago, so we're not going to do anything in that area, and that's really held up well. We use that new Revinesse filler. And how do you like those so far?
It was a really positive experience. I must say, I felt very refreshed, and it definitely changed my smile zone, my smile line, and people noticed that. They couldn't pinpoint exactly what it was, but they knew that there was something different. Yes, I was very, very pleased. Thank you, Doctor.
Yeah, you're welcome. Yes, and that filler has been working really good. Really impressed with it, and it's holding up well. Alright, so I've made some marks where we want to do the botox, so this is going to help us get the result that we want. So now we're going to do kybella. And kybella works by breaking down the fat cells and reducing the tissue in that area. Kybella also works by doing a series of treatments. So it's not necessarily a one and done. It usually takes 2, 3, 4, 5 times of doing kybella to get the effect that we want. And with the jowl area, that can take a little longer because we have to limit how much we put in that area at one time. And so we have some ice on here because kybella stings when it goes in, but we kind of marked the area where we're going to address this, and the ice helps with that stinging. It makes it more comfortable. Alright, so I got done with the kybella, and kybella goes in with quite a bit of fluid, and so immediately after it'll look a little puffy, we could say, but it also creates some swelling. And so this area is going to swell up a little more, probably for a few days, and then it'll go down and be back to normal. And typically with the first treatment, we don't notice much change. So it's usually after the second or third treatment that we really start to see the effect. And it is a little stingy, but how does it feel?
I think that's a really good way that you put it. That definitely, the ice does tampen it down. It dampens it down quite a bit. But yeah, it does feel pinchy, a little bit stingy. It definitely does. I can feel it right away. It's very tingly, very tingly.
Okay. And sometimes we can also get a little numb feeling, which that's normal, and that typically goes away within, sometimes it's a month, sometimes about 5 weeks, kind of that range. So we're ready to start the threads, and what we do with that is up here we're going to numb that area, and then we make a small hole with a needle once it's numb, and that allows us to place the thread needle into that hole, and then we're going to follow these lines with the thread, and then as we pull out the needle, we lift up on the tissue so the threads hold it in place, and we get a non-surgical facelift. Alright, so I'm going to numb this spot right here. This is just some anesthetic. So you're going to feel a little pinch, and we're going to have a little stinging. And then we're going to make an entry hole. Does that feel numb?
I think so.
Right there? Okay.
I think so.
So we're going to make a little entry hole. So a little pinch here. And we're going to do just a little bit more anesthetic here. And I'm just going to go down a little bit with each of these lines. And sometimes it can bleed right there. We'll see. Alright, so these threads, they're a little long. But we're just going to go to about right there. And as we slide this down, if it's sore or uncomfortable for her, she can raise her hand and we can place some anesthetic there to numb that and make this very comfortable.
Yep.
Alright, so we're going to do our filler, and we're going to use some Voluma. We're just going to add just a little extra in the cheek area. Alright, so we got done for today. We did Botox, kybella, threads, and filler. And right away we can see a difference with the threads and the filler. We can see the difference in just the jawline and some of the folds. Went really smooth from our standpoint. How was it for you?
It was very comfortable. I think more than anything else, it was great to have that level of communication with you so that you were able to address the little bit of discomfort that I had very quickly, and so the process all went so smoothly. I'm very, very pleased.
Great. And one thing we like to do, which is an option, is with the threads to put some tape on the face to help just hold this up. It has two purposes. It helps to get better lift with the threads, and it also has a soothing effect with it. Would you like us to do that for you?
Very much. I think that would be a great service, and I would appreciate that, yes.
All right.
Doctor, can I ask, are there any special contraindications? Are there things that I should be mindful now, having done this? Tell me more.
So with the threads, the face can feel tight.
I noticed that right away.
Yep. You know, so you probably don't want to go eat a Big Mac or Whopper type thing. You know, 'cause if you open, you'll feel it. You know, with the filler, you don't want to sleep on your side or your stomach, because the filler is moldable for about a day, and so you want to sleep on your back.
Okay.
And it's good to avoid aspirin, ibuprofen, things like that that contribute to bleeding, which then cause more bruising.
Okay.
So,
What about drink a glass of wine? Would that be contraindicated?
again, alcohol can contribute to bruising because it thins the blood. So it's not that you're going to hurt it, but you just increase the risk of bruising.
And what about like exercise immediately?
That's fine as well, although I would suggest you take it easy because this was kind of a lot that we had done.
Okay. Thank you very much.
Thank you. Alright, so we got the tape on, and it's just regular KT tape that we use. And how does it feel?
It really holds you, and it's almost like someone wraps you in a blanket. You feel more secure, and you actually feel protected, and it actually feels extremely comfortable.
Well, good. Yeah, so this helps to hold the tissue up, and it gives that soothing feel, and we get a better result with it when we use it. Again, it's optional. You know, some people don't want to go home looking like this, so that's fine. But for those that don't mind this is a great way to get a better result. Now, you did ask about exercising.
Yes, I did.
And you know, after something like this, you don't want, I'd say you really probably don't want to go exercise, because you really want to just go home and relax. Is that kind of how you feel?
Yeah, I appreciate that sentiment, and I will take that advice. I think that's smart advice. I will.
Okay. All right. Well, thanks.
Well, thank you, Dr. Miner. It's been a pleasure.
Equally.